got two beautiful bypasses, as pretty as you could be, and he has, the heart normally has three kind of equally sized arteries, right? LAD, circumflex. His right is smaller, and this part is damaged right here. He's had a heart attack some time ago, years ago, I suspected. A little bit of that is dinged up. The rest of his heart works fine, and his overall heart function is only slightly decreased because this part here pumps so good. Anyway, so you got a beautiful chest artery bypass to this one in the front, and it was about 80% blocked right there. And he has to have this one to live. So, and he got a beautiful bypass in there, and that thing ought to last 30 years.
So that just completely nullifies all three of the blockages that was in that artery?
Yeah, it goes past any blockage in the artery.
Okay.
And he has a big, after that, going in, there weren't any other arteries that looked really big, but I found a big one right here. That guy there is a good size. And we got a beautiful vein bypass in that one right there. So by getting that one bypassing that one, that kind of takes us around about right there. All the muscle up to there is covered pretty nicely. So I'm real happy with what we were able to get done for him. Like
And
I said, this muscle here doesn't matter much.
That's what I was wondering, if how much does the other rest of the heart then overcompensates for that one that's not?
It does that. He's done fine. He's been like this a long time. He'll do fine with that. As long as this is good, he'll be good.
Okay.
I mean, it's it's like a car with a 350 engine or 496 or whatever. They'll both go all he wants to go. So he looks great right now. His heart function looks very good overall. The bypasses were excellent. They both had great flow, which makes me think they'll stay open and last a long time. Now I tell everybody, my standard speech is 3 things we worry about today. Say the same thing every time. The first is always bleeding. 1 out of 20 will start bleeding enough for me to have to take him back to surgery tonight or in the morning or sometime usually in the next 6 hours. There are 1 million places you can bleed from after heart surgery. I've seen most of them bleed over my career, but he seems very dry right now, and I expect that to continue. However, if I do tell you later he's bleeding, don't freak out. We'll get that fixed 99% of the time. If we take people back, it's usually one spot, fix it, and go on about our business.
If it's internal, are you just going by the blood pressure to know whether it's?
No, it's a very good question. We got 3 tubes in his chest, sucking blood from various locations. They're under suction, and they suck blood into a clear plastic canister, so we know exactly how much they bleed. Second thing we worry about is stroke. Stroke's usually caused by calcium in the aorta, because we got to clamp the aorta and all that stuff. He didn't have any calcium there, so his risk of stroke should be very low, like 1 in 100 or less. Third thing we worry about is heart function. You can see in the video, heart function looks very good overall. So I'm super happy with him. Think he's going to do well. He looks very good heading upstairs. Dr. Pickett did a great job. The anesthesia had great helpers in there today. So we had a very good day. Real pleased.
Will he be on blood thinners then when he goes home?
He'll be on aspirin aspirin for life, Plavix for a month is what I usually do, unless they have a bunch of AFib, and then sometimes they get another blood thinner. But
So
aspirin, Plavix.
Does any of this result in AFib, or is just kind of people that have AFib?
40% of people in the first 10 days after heart surgery will have some AFib, but that usually goes away. We usually don't put them on Eliquis or something unless we think they're going to be in it some more. Anyway.
I was just wondering about the other rest of his arteries in there, maybe having some blockages and breaking loose. Is that likely?
No. These blockages never break loose. They're concrete in a ditch. They don't move. So anyway, now we let people slowly emerge from anesthesia. It takes 4 or 5 hours for them to get good and awake, and to get awake enough to get the breathing tube out. The next 4 or 5 hours, I want to say, wake up, move everything, not bleed, then get extubated and get the breathing tube out. Then he can talk to you then. I don't encourage people to stay all night, but you certainly can if you want to. One person can stay in the room if they want to. But again, I don't encourage that because you won't get much sleep, and he won't hardly know you're there tonight.
Well, we just always did it as a precautionary, because sometimes the nurse will have their back to the patient, and we
Not
can't
here
keep it.
tonight, they won't. They'll be watching him like a hawk. So you do what you want to do there.
Okay.
Anyway, they should call you to come see him about an hour and a half. If they haven't called you to come see him an hour and a half, just go to the room they told you. They tell you your room assignment.
210.
210.
Just go up there an hour and a half if they haven't called you.
Okay.
All right, thank you guys.
Thank you
Appreciate
so
it.
much.
Thank you, big guy.
Yep, thank
All
you.
right, anyone have any questions?
Well, I had the one,
Is there any kind of lifestyle changes that he needs to make to prevent this from happening to the bypass?
Oh, he's 73. This will last until he's in his 90s, I would think, or close to it. You know, I mean, so I wouldn't. He doesn't have to eat baked fish every night for the rest of his life. For me, so.
Darn it.
Is there any? Is there going to be any?
Not a big deal is if people smoke. I tell them to quit smoking. Take an aspirin and take your cholesterol medicine. You know, some people are kind of anti-statin for no reason. Some people can't take statins, but most people can take them and should take them.
what about chewing tobacco?
Well, that's kind of bad for, you know, my small risk of oral cancer and stuff, but doesn't bother me for his heart.
But he can't have it while he's in the hospital.
I don't care if he is. So, but anyway, the nurses will probably have to call me or something like that.
Is there going to be any kind of circulatory issues with his legs from him taking the veins? What?
Shouldn't be. The veins are they're the highway back to the heart, so arteries carrying our blood in, if those get compromised, it's a deal. But no, the leg will swell for a while. Sometimes they're bruised, but usually after a while they look good.
Okay.
So didn't he have a little heart valve issue that needed some attention?
Nothing's bad enough there to mess with.
Well, he told me the last time when I asked him about that they would go up through the groin if they ever decided to fix that. Correct?
Yeah, he doesn't have a heart valve issue bad enough to mess with. So,
Okay.
all right, thank you guys.
Thank you.
Appreciate it.
Thank you for your